Hi, Assalamualaikum. My name is Muhammad Nazri, and my matric number is 2020891954. This is our group member, which is Mio Yasin bin Mio Hassan, Muhammad Syami bin Sulaiman, Muhammad Nazar bin Nazri, which is me, Muhammad Faris bin Muhammad Fauzi, Juni Karimah binti Nur Jamadi. And today we present about sports skill analysis. That we choose the sport is futsal. The skill is passing. So firstly, for the introduction, the ball pass on futsal is the act of sending the ball to a teammate. The most used passing skill is performed by touching the ball with the inside of the foot, which is the so-called pass lead. And the skill in this practice is that the players drag the ball with the instep of the right foot across the body. So this is the common part most passing in futsal, which is short pass and long pass. So firstly, muscle involved for the preparatory phase. So basically in this phase, which is futsal and passing, the players is prepared to pass the ball. So the muscle that involved in this phase is firstly is gluteus maximus, secondly is sartorius, thirdly is quadriceps, and fourth gastrocnemius. Next one is soleus, and lastly is hamstring. So for the next slide is follow through. So for this phase is the situation is the player is ready to pass the ball. So muscle that involved in this phase is same from the previous slide, which is gluteus maximus, sartorius, quadriceps, gastrocnemius, soleus, and hamstring. Okay, so for the third phase is kicking. So muscle that involved in this phase is gluteus maximus. So basically is gluteus maximus is your boot muscle, which is it rotate and extend the hip when you are kicking a ball. So for the next one is sartorius. In this phase, sartorius works alongside your quadriceps to externally rotate your knee, so you can kick with the ball with the inside of your foot. So for the muscle of quadriceps, the function of the quadriceps is the main job is to extend the knee and flex the hips. So for the next muscle is gastrocnemius. So function of this muscle is to pull the heel up and thus extends the foot downward. So for the muscle of soleus, it also known as your calf, which is to contract to extend your ankle in the leg movements, which is contract to hold your ankle grip. So for the last muscle, which is hamstring, it works as you kick the ball, as they help decelerate the speed of your leg during the final of part of the kick. So we will move to the bone involved in this preparatory phase. So basically you can see this is three lists of bone that involved in this phase. Firstly is tarsal, secondly is tibia and femur, and last one is tibia and calcaneus. So for the next phase is bone involved that occur in the follow through phase. So basically it's same for similar from previous slide. Firstly is tarsal, secondly tibia and femurs, thirdly in tibia and calcaneus, and fourthly femur and pelvic girdle. So basically follow through is it's occur when the player is ready to pass the ball to their teammates. So for the last phase, for the bone involved in kicking, so in this phase, which is kicking, the bone that involved is similar. Tarsal, which is the tarsal is provide the contact surface that strike the ball. So for the tibia and femurs, so for the function of tibia, the hip joint which is connects the femur to the pelvis, which is served as the crossroads for kinetics chains that transmit power to the ball. So for the calcaneus, known as an ankle motion, is an important factor for kickings and reduce mental fractions, and it's beneficial to the ball velocity and kick distance. So for the next last bones, which is pelvic girdle. So for the function of this bone is retract before support foot contact and uh, protracts through a significant range of motions to ball impact.
Assalamualaikum warahmatullahi wabarakatuh. My name is Biomechanics. My metric number is 2020457298. So I will explain about the joint movement terminology that occurs in futsal passing. So firstly, before passing, when we're about to kick the ball in a static position, our hip, knee, and ankle joint first will be flexion, which is the largest joint action that were needed when we're about to passing the ball. Then after passing the ball, which is the impact after the leg impact the ball, touch the ball, the our hip, knee and ankle joint will be extension as it was the effect after the impact occur. Okay. Next is about the synovial joint. So the synovial joint that were used in this method is plane joint and ball and socket joint. So for the plane joint, the carpal bones, intercarpal joints of the wrist and tarsal bones, which is intertarsal joints of the foot, will be used in the passing. This sort of joint typically has limited motion that is firmly restricted by the surrounding ligaments. And because of that, the movement can include in rotation that will be functioning classified as a multi-axial joint, but depends on its ligament or neighboring bones. So this kind of plane joint will be used in the passing to make sure that the athlete ankle will perfectly use to pass toward the ball. And then for ball and socket joint, the hip joint was used in passing as it's using the femur bone to move in both anterior, posterior, and medial lateral direction, so that it can also rotate around the long axis. So this kind of bone will make sure that our leg can move and rotate towards the player that we want to pass the ball. And then for the sequence of movement in passing. So firstly is the preparatory phase. So in this phase, the body athletes will be in a ready static position with his dominant with his non-dominant leg behind the ball. So as the diagram show, his left leg was behind the ball, and then the athlete also have to make sure that the athlete body and his leg was straight with the ball in line with the other person that the athletes want to pass. So the athlete has to look to the his teammate that wants to pass, and then he will go to the executive phase which is the athlete has decided to pass the ball towards his teammate. So the athlete has to swing his dominant leg in order to make a contact with the ball. So to make sure that the ball going straight towards his teammate, the athlete has to make sure that the side of the foot touch with the surface middle of the ball, so that the ball going straight through his teammate. And then lastly, for the follow through pace, as the ball is going toward its teammate, uh, after the impact with the ball, like let the athlete leg swing forward a little as a motion of movement, so that the ball drive nicely towards his teammate. This is to make sure that the impact of the ball will go nicely, and the ball will be passed toward the teammate successfully, straight without any fail. So then the athlete has to find a space to receive the ball again, so it can be useful in the real situation game.
Hi, Assalamualaikum. My name is Muhammad Faris bin Muhammad Fauzi. My metric number is 2020887476. For today's presentation, I would like to talk about the kinematic and kinetic. Futsal passing was studied using kinematic measures. The foot of the supporting leg and the knee, hip, and ankle of the kicking leg was noted throughout the measurements using the motion analysis program. The two main variables that were produced and analyzed were knee angle at the head of the backswing. The two movement factors were found to be crucial for futsal abilities like passing in earlier studies. It is essential to remember that there are various more crucial kinematic factors, such as the passing foot's acceleration and velocity. Only for passes in the shorter distance circumstances are the results of the kinematic data analysis reported.
Assalamualaikum and hi. My name is Muhammad Syami bin Sulaiman. My metric number 2020497328. Today I would like to explain about technique of skill performance in futsal, which is passing. Passing is an effective way of keeping possession in any match. There are mainly two types of passes, which is long pass and short pass. Type of long pass are typically used to switch up plays, such as making a quick counter-attack break. The example of long pass is driven pass. A driven pass simply means to get the ball from point A to point B in the quickest time possible. Next is types of short passes. Approach the ball at a slight angle of roughly 30 degrees while executing a short pass. As a general rule, your spine should be upright and you should lean into the pass shortly before striking the ball. The example of short pass is chip pass, wall pass, and back heel pass. For the chip pass, it's a technique used to pass the ball to a teammate over a defender who is in the way by kicking the ball up in a long arch. For the wall pass is this idea of this pass is to pass the ball to your teammates and quickly sprinting forward into space and receiving the ball back from them in one touch. Now I will explain about the way to improve the performance. The first thing is suitable shoes, and the second thing is communication. In futsal shoes very important, because if the shoes suitable with you, and the benefit is that you have better ball control because you feel very comfort. And for the communication, it contribute the increased performance and concentration on the court, reinforce the speed of the game by telling your teammates what you are about to do, intensifies the speed of decision making, motivation, and enhance leadership. That's all for me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Juni Karima binti Nur Jamali and my metric number is 2020C86444 and I'm from class D. So today I'm going to talk about the conclusion of our presentation. So passing was one of important skill that need to have by all futsal athlete because when they performing a good passing can bring a good performance to them. By making this video, it will help the athlete to evaluate their performance to improve their skill to be better. The method that have been developed in Biomechanics will help the athlete to analyze the skill and maximizing skill performance to athlete. By that, all the athlete can determine their mistake and prevent any injury at the same time when they understand the biomechanic function from that video. The correct movement can build the better performance for the athlete. Other than that, from this video, we can see that every movement the athlete does, it will involve muscle, bone, and joint. Muscle, bone, and joint that attach with together can create the most powerful movement for the athlete to produce a good passing movement, which is the better passing movement. So without all of this, our movement will not move as we want because this system gives our body its structure and support that we like us to move around.